Hello, I'm Wendy Turell, VP of Outcomes and Analytics at PlatformQ Health Education. Our poster today highlights a virtual CME program on non-small cell lung cancer put forth in collaboration with the Albert Einstein College of Medicine to address clinical knowledge and competence gaps pertaining to newly approved treatment options and established guidelines. The program was originally broadcast live and endured on demand for 6 months. Interactive features included live Q&A with learners and interactive polling. Please see the learning objectives listed here and on the poster, as well as our faculty presenter, Dr. Sequest. Engagement statistics from the program are highlighted on this slide. Notably, there were 512 learners and 150 responses to in-session polling. We assessed the effectiveness of the program with pre-test, post-test, and 2-month follow-up post-test methodology. At 2 months post-education, 75% of learners reported positive clinical practice changes, and 67% reported positive impact on patient experience and outcomes. Some write-in responses by learners are highlighted in quote bubbles on this and the next slide. One example is, I have a better understanding of immune-based therapies and now can explain them better to my patients. This and the next 2 slides highlight results of the pre and post-testing. Due to time, I won't go through each question, but overall, all of the programs show a positive pre to post lift. And each question also aligns to program learning objectives. In conclusion, this initiative was effective in supporting oncology team members who manage patients with non-small cell lung cancer who are on immunotherapies. Self-reported practice change examples demonstrate improvement in patient and provider communication, clinical practice, and confidence in applying management strategies. Thank you for your time.
To start off, I'd like to ask you a question about what you would do. This is a patient from my practice, a 52-year-old female, former smoker of 20-pack years, no active medical problems. She presented with a lump in her left neck. Someone asked, what is the current recommendation on sequencing one checkpoint inhibitor with another? In other words, I think they mean that if a patient progresses on one checkpoint inhibitor, should you treat them with another? Especially if you're general practitioners, you are trying to remember a lot of data with immune checkpoint inhibitors in many different types of cancer. For your reference, here is a list of the approvals in lung cancer for the various drugs that are currently approved, at least as of the very end of 2018. As far as PD-L1, the most common biomarker, at the beginning when these studies were first coming out in 2014, 2015, it was a little bit confusing to try and wrap our heads around the PD-L1 levels because each different company that was developing each different drug was using a different antibody for PD-L1. And it essentially categorizes some of the major trials in immune therapy in lung cancer by at least 3 of the drugs that we'll be talking about, nivolumab, pembrolizumab, and atezolizumab in the columns. And then if you look across the different rows, these are different settings. So a very important study. Patients are now receiving durvalumab routinely after concurrent chemo-RT. However, with stage 3 disease, unfortunately many patients will recur. And so this viewer is asking, how would you treat a patient that does progress after this treatment? Would they be considered, would you add in IO to their chemotherapy?